Good morning. Assalamu alaikum, everybody. And those visiting us from overseas, a warm welcome to the magnificent city of Dubai. It gives me great pleasure to be here this morning with you all. And I want to thank Professor Stipp and Dr. Ghanem for this opportunity. We've been given 10 minutes each, and we'll try our best to give you, bring it in a nutshell, the extensive efforts that we put together towards integration of digital technology. So, just to be, precise, as staggering as these numbers are, and by now I presume these numbers are etched in our mind, how terrible the state of mental health is going to be in the next decade. The silver lining that came out of COVID-19 was that we got the momentum that was not, that was not given to us as a mental health specialist and mental health providers for several years. So this momentum has propelled us not just in terms of research and providing better care, and everybody around the world speaking about mental health as an important issue, but also the digital technology and the startups that have come up as a result of the pandemic that we went through. It's very promising, and I always consider that this was one of the silver linings that we came out with. Recently, the 2020 Global Innovation Barometer has ranked UAE as one of the top countries providing a very innovation-conducive environment. And of all the sectors that were studied, the healthcare sector took the lead. So we are known around the world to outdo things. We don't do just the best, building or the best ride. We do the fastest and the tallest and the biggest. So it's no doubt that UAE has taken the lead even in mental health or innovation for that matter, because our leadership has been very, very supportive and very much advocates us to do and deliver the best we can. In a nutshell, I'm going to give you a brief about the Abu Dhabi's mental health strategy, whereas my colleague, Dr. Noor, is going to be presenting about the DHA and the Northern Emirates or the Ministry of Health aspect. So in Abu Dhabi, I'm delighted to say this was a pre-COVID model, actually, just got momentum through COVID. We have devised a model which is divided into three broad themes: staying healthy, getting better, and sustaining health. And under these broader themes, there are several initiatives that have been tucked in. And as you will see, some of those initiatives require digital incorporation. So staying healthy, basically, in short, is just about prevention, awareness campaigns, and doing a lot more screening. Getting better is where we are talking about the easy access to mental health, meeting the workforce demands, standardizing care. And sustaining health is all about reintegration. Our digital transformation comes under the cross-cutting aspect of the model, wherein we have identified several channels where bringing digital technology into healthcare is going to solve quite a few of the questions we have in mental health care delivery. These are our partners in the different stakeholders besides the Department of Health of Abu Dhabi. We have DCD, which is the Department of Community Development, Abu Dhabi Education Council, the Abu Dhabi Public Health Sector, and the ECA helping us deliver these initiatives. And these are the initiatives that highlight the digital innovations. So most of you from around here are aware of how much Abu Dhabi has done in terms of integration of mental health into primary care. This is our effort that we bring in community access for mental health. We are expanding at an exponential level. We have community hubs that deliver psychiatric care in the primary care settings, addressing stigma, addressing access to care, addressing the early diagnoses and whatnot. So part of the integration of mental health also has digital integration attached to it. So we want to see how, when a primary care provider is initiating treatment or screening, and we integrate it with psychotherapy through some of the apps that have come up, how good are we in terms of providing early access to care and providing a holistic care. You'll see that we have given these platforms to many of the startups in order to see the feasibility. We want to make sure these apps do what they say they do. So therefore, as providers at our end from SEHA or our colleagues in the private, our efforts have been to utilize these concepts and to study their adaptability and their feasibility in our practices. The other one is the telepsychiatry, and I'm happy to say that telepsychiatry was pre-existing before COVID. We used to provide, especially in Seha, to our community in Gharbiya, which is around 3 hours drive away from Abu Dhabi. But through COVID, we made sure this was more rampant, it was more accessible, and we did not have, through the pandemic, any patient fall through the cracks. The services continued as they were, or even better for that matter, through telepsychiatry. We have mental health coverage through, we're increasing the number of coverage through insurances, and we are trying to expand this even to the smart apps that have come up to and promise to provide telecounseling. The data sharing is another approach that we have tried to utilize in terms of technology. We are preparing a patient registry at the DOH level, and the point is not just to collect the numbers, but also to put them through tools that give you predictive analytics and to see how we can reform our healthcare in order to serve our community best. Last but not the least, the MH13 is the prominent one in terms of digital technology. This is where we bring in different entities in order to support the startups. So basically, the technologies in mental health that were identified were through telepsych, AI-based chatbots. We had predictive diagnosis apps, and that is cognitivity is one. DHA, Dubai beat us in getting it ahead of us, but we are almost there. This is an app that promises to diagnose early dementia, and it does not have to be, dependent on the literacy level of the patients. And again, mental health self-care apps. We're very proud to have several of these homegrown apps doing a wonderful job and meeting the needs for the community at the moment. AI Lab is a sector under the Department of Health Abu Dhabi. You can read more about them on their website, but what we, in a nutshell, do is that we pick up an idea, conceptualize it, and channel it in a way that the providers can, send them through the POCs or feasibility studies, and then see if this is a promising app before we release them for RFPs. Benefits from digital mental health, there is a no-brainer. These are very straightforward. And the way we try to judge these apps and these startups is based on these goals, values, and attributes that have been highlighted by the toolkit for global digital healthcare. Plug and Play has been very instrumental in channeling our efforts because it's a VC firm who works closely with Hub 71 and MAN. They bring in different contenders in terms of new startups and they pitch in. So we had in mid-October a pitch event where some 6 startups were selected. They all promised to deliver mental health care. And we're very happy to announce that the winner was a homegrown Emirati-led entity called the Kallam. And you'll hear more about them tomorrow. So basically, this is how we're trying to support them. The innovation ecosystem is growing through these 2 entities. Hub 71 is a Mubadala-backed company that provides all the dedicated access and resources to these individuals who are interested in providing innovative solutions. If you're in Abu Dhabi, you should visit their offices. They are fabulous. MAN, again, it provides funding and they hold a pitch event. So incredible amount of support has been laid out, and this helps many startups to thrive and deliver the promise. So just to close, I hope I've kept the time limit. We are doing as good as we're doing just because of the leadership and the vision of our leadership. We did a fabulous job through pandemic, not because we were prepared or not just because we have a very robust healthcare system, but because of the compassion our leaders have. At the peak of COVID, when everybody was talking about social distancing and vaccination and infection control, our beloved leaders spoke to us about our emotional vulnerabilities. the fact that he came out and said, don't worry, was the one which took us to where we got through the pandemic. So nothing could have been done in UAE without the support of the leadership. Thank you.
Your Excellencies, ladies and gentlemen, good morning. I would like to thank the organizing committee for organizing such a wonderful conference. And I will speak about the digital mental health strategy in Emirates Health Services, which is the health care organization providing health services for the Northern Emirates. So our vision is to provide world-class mental health services, and we look at the patient at the center of our care. And with that, we look at the patient journey from awareness and prevention, diagnosis, and then rehabilitation, and going back to the community. And one major pillar within that model is the digital mental health and how it is helping us to improve the accessibility of the care and within the whole journey. So as Dr. Nahida, we took actually the healthcare model based on DOH healthcare model, where they divided also the services into hospital and community-based services. And we are implementing the stepped care model, where we focused our interventions at the community care, going to the primary care, secondary, and then tertiary. With the mental health strategy in EHS is aligned with the national mental health policy, which was announced in 2018. And within that strategy, we have the leadership and governance. We do have how to provide a comprehensive mental health services, looking at the step care model as the basis for the mental health care model, and the digital mental health solutions, data research and innovation, and also how we invest in training and improving the resources for mental health services in general. So this is now how we are implementing our initiatives within the digital mental health strategy in EHS. So we are building disease-specific registries, also looking at clinical excellence, how we are developing disease-specific clinical modules within our EMR to make sure that we do have standardized documentation, evidence-based order sets, and care plans within the multidisciplinary team, and the transition of care from one facility to another. And also we are implementing the analytics. So we do have the PACE program, which is the Performance and Clinical Excellence program. This is the main data warehouse for EHS, and we put all electronic systems, the data that comes from electronic system in one database. And from that, we develop our mental health dashboards in terms of operational KPIs, patient-oriented outcomes, and of course, the AI on the top of the database. Some examples of the initiatives that are implemented in EHS are the virtual care. So as you know, within the COVID, we started actually the mental health services. It was started first. I remember that in March 2020, within 2 weeks, we implemented 100% telepsychiatry in all facilities in Emirates Health Services. And the first pilot was in our tertiary hospital, Al Amal Hospital. And alhamdulillah, from that time, the people loved the telepsychiatry actually, with the highest satisfaction rate among all health services. We made sure that we put a proper policy within the telepsychiatry, and it tackled the whole multidisciplinary care. So all psychologists, dietitians, pharmacy, there is telepharmacy, and of course the home delivery for our patients. This is the workflow for the telepsychiatry, and as you can see, it starts from the beginning, where we send a message for the patient. We make sure that he knows about the approach and the workflow. Then a nurse called him, making sure that she takes all, in terms of vitals, if they do have home machines, and later the symptoms, and then transferring the call to the physician. The physician will put his notes and finish his consultation. And within that, we make sure it is connected to the allied health if he needs any lab, pharmacy, or diet advice. Also, we expanded our community telepsychiatry services. So we started certain subspecialties in primary healthcare centers that are supervised by our tertiary center, Al-Amal. So we opened child psychiatry, intellectual disability, elderly psychiatry within the primary healthcare centers. And this is an example of how we started the personal Amal with all subspecialty, community care, and also walk-in services. This is the telepharmacy and how we do have the service for our patients and making sure that their medication reach them at the time with the proper consultations. In terms of artificial intelligence in mental health, we implemented the Cogni ISA, which is AI dementia screening in primary care. It started actually just at the beginning of this year, and it was presented also in the Arab Health Conference. And we started this pilot as a screening method in the primary healthcare center. So they have this iPads which have this automated ICA. The software takes only 5 minutes, and then it can screen the patient if he is positive and negative. We have put in a policy around the dementia screening program in primary care, and the sensitivity for our first batch was around 90% and the specificity 85%. And we are planning to expand the implementation of the dementia AI to cover the whole Northern Emirates. Also, we implemented telemonitoring system within our tertiary hospital, Al-Amal Hospital, where we have put biomedical sensors within the rooms to make sure that we predict early violence or risk for our patients. And we are going also to expand that and to have this telemonitoring also for the outpatient, for the addiction programs. Within the behavioral health EMR, we started, actually, we do have the behavioral health solution in our EMR, but we made sure that it is localized to our needs. So we do have the main subspecialty within the EMR, and in each section, it is localized, evidence-based to our needs within the facilities. And these are examples going from emergency, inpatient, and through the different specialties. The last one was the community mental health, where also we made sure that all workflows are automated in terms of home visits, acute intervention, crisis team, everything is documented and aligned with our policies, procedures, and evidence base around this practice. In terms of data and analytics, as I said earlier, it's one of the major also focus. How do we know that we are providing good care and we are monitoring our programs across the continuum of care? So we do have the PACE program, and we have the operational outcomes and the patient-oriented outcomes within our programs. And these are all, before it was manual, and now it is all automated. Where we are going in the future, we are looking more at three main pillars in terms of digital mental health, looking at solutions for our community, and in terms of awareness and preventions, portals, chatbots, something there to give the patient more information and awareness about the mental health services. Then internet therapy, how we can improve the service using IoTs and other digital solutions within the medical services. And also the e-learning is a big part within that strategy. Thank you.